Welcome to a Gerontological Society of America Momentum Discussion podcast, where we delve into topics that are generating great excitement and advancement in aging.
Welcome to this GSA Momentum Discussion podcast episode titled Emerging Issues in Obesity Care for Older Adults. Momentum discussions highlight topics experiencing great momentum in the field of gerontology. We're grateful to Novo Nordisk for their support of today's podcast episode. My name is Jen Pettis, and I'm the Director of Strategic Alliances at the Gerontological Society of America, or GSA. And I'm recording this podcast episode live in the podcast booth at GSA 2024 in Seattle, Washington. I'm joined today by my friend and colleague, Dr. John A. Batsis, an associate professor in the Division of Geriatric Medicine at the School of Medicine and in the Department of Nutrition at the Gillings School of Global Public Health at the University of North Carolina at Chapel Hill. Dr. Batsis is a member of the GSA Obesity Advisory Panel, and along with Dr. Katie Porter-Starr, he leads the GSA Obesity and Aging Interest Group. Welcome, Dr. Batsis. I'm so glad you could join me.
Thanks, Jen, and thank you, GSA, for the opportunity to come and speak at today's podcast Momentum Discussion.
Thanks so much. There is a great deal around care for older adults. It's wonderful to have this opportunity to sit down with you to offer our listeners some insights into some important issues going on in obesity care. We've heard much about obesity's links to other conditions. To start, let's talk about cognition. Can you tell our listeners how obesity impacts cognition over the lifespan?
And you're absolutely right. This is a great and really exciting time for obesity as a chronic disease, and how we're excited to be able to say we have a lot of good research and changes in clinical care that are hoping to be able to affect the lives of our older adult population. So obesity in and of itself is a disease that affects the person over the course of their lifespan. And we know from our data that it actually can affect one's cognition. We have evidence to suggest that there is a higher risk of developing cognitive impairment the longer the duration of someone having excess fat over the course of their lifespan, the higher the risk of developing cognitive impairment over the course as they age. And that's a big problem. So we want to be able to target this disease early on in the process.
Are there any new data around obesity's link to other major medical conditions?
Most recently, and really in the last year, there's been a flurry of new studies that have come out, not necessarily only in older adults, and I think that's really important for our listeners to be aware of, but there's been a wealth of data to demonstrate that the newer incretin mimetic medications, these GLP-1 or GLP-1 GIP medications, demonstrate reductions in risk of cardiovascular disease, kidney disease, cancer, sleep apnea, and the number of different diseases that these medications are leading to. It's every week it seems as though you blink your eyes and there's another study that's coming out. Again, I want to caution our listeners that it's not necessarily older adults, and the majority of these trials are in a general population. That's not to say that they don't include older adults, but they're not focused on older adults. These are really exciting data, and particularly cardiovascular disease. And the reason I say that, age is the strongest predictor of developing cardiovascular disease. So we know that these medications can reduce the risk of developing cardiovascular disease.
It's wonderful that there's all of those benefits that we're finding out from these medications. And with the significant weight loss due to the GLP-1s that is possible, we have concerns, particularly for older adults, around loss of muscle and bone. What advice do you offer older adults taking obesity management medications to address this issue?
Particularly over the last year, there's been an increasing concern amongst clinicians and researchers that these medications, we know semaglutide and tirzepatide can lead to profound degrees of weight loss in the amounts between 15 and 30%. This is unheard of. This is starting to approach the degrees of weight loss that we see with bariatric surgery. And we know with bariatric surgery, individuals that are treated with bariatric surgery can lose significant degrees of muscle mass and bone loss. Now, we also recognize that we have a limited amount of data as a result of these newer medications on changes in muscle mass and bone. So I think it's really important to caution our listeners. When someone loses weight, they're losing not only fat, but they're also losing muscle, bone, connective tissue, organ tissue as well. So it's not just muscle, not just bone. There's a plethora of different tissues that are being lost. And what we don't know is the sweet spot. What is the sweet spot? By the amount of fat. We know loss of fat will lead to metabolic benefits. We have great data on that. Are the benefits from that loss going to exceed the potential harms? And I use that word deliberately, potential. We don't know, because we know weight loss can lead to improvements in physical function. So it's a balance. We don't have the data.
What advice can you offer the older adult, though, that is taking an obesity management medication to be as healthy as they can be while they have that weight loss journey?
In my practice, these medications are ones that I routinely have discussions with patients who, a number of them come to me and they say, I want to start talking to you about these medications. Okay. I sit Mr. or Mrs. Smith down with me and I say, let's talk about what are you doing right now? We know obesity is a chronic disease. We know behavioral lifestyle therapy is the cornerstone of any treatment modality. We know that GLP-1s can lead, or GIPs, the incretin mimetics, can reduce weight. We know the potential impact on muscle and bone. So we need to put all this together. I generally strongly encourage, and ensure that my patients on these medications have made significant lifestyle changes. Have they seen a dietitian? Have they altered their diets? And when I mean alter the diet, are they consuming a Mediterranean type diet, a DASH type diet? Are they doing what they can as best as they can? Are they exercising? What type of exercise? Aerobic resistance. Have they seen a physical therapist? Have they seen an exercise physiologist? They may not be available to everybody. And that's in resource poor settings, that may be a challenge. But are they getting engaged? There are many virtual programs that are available. Many senior centers have programs that are available to our older adult populations. But there are individuals and persons with obesity that are able to do this and able to engage. And if they're doing that, those are the ideal candidates, because we know that resistance-based exercises and adequate nutrition, and I'm going to incorporate ensuring protein supplementation as part of that, will mitigate any potential loss of muscle and hopefully mitigate any potential loss of bone that may occur with these medications. What does that mean? And this is where you need multidisciplinary and interprofessional team-based care to be able to help you. Work with a dietitian. They can help figure that out for you and be able to say, okay, this is what a usual amount of protein is. Are there protein supplementation, or are there different types of foods that you can spread during the day? Are you able to use it during exercise? Yes. And often you prime the muscle with exercise, you can take the protein supplement post-exercise. And that's something that we often recommend, at least in our studies.
My last question for you has to do with marketing of products that can be bought over the counter or online that claim to work similarly to the GLP-1s. When your patients ask about these, how do you advise them?
Increasingly, there are a number of compounded medications that are being marketed by a number of companies. I think anytime these are brought up, I think we need to be mindful of them, of the source, be able to understand their quality control. There are position statements by formal organizations that currently that note that these are not formally endorsed. There are some hospital-based systems that have done some other quality control kind of evaluations on specific ones. And I think different organizations are able to evaluate different local companies, but really, or compounding pharmacies, if they're affiliated with a local medical center. But generally, we tend to say, best to stay away from these compounded medications because we don't know if they've undergone regulatory approval, FDA approval, quality control approval, all the steps of good practice that any type of medication undergoes through. And this is really a problem because you don't know what you're getting.
Sure. Dr. Batsis, what are some final thoughts you want to leave our listeners with?
I think we are in a really exciting time in obesity medicine. One thing that we haven't talked about is the complexity of our patients, of our older adults. Older adults are complex. They're different. One older adult is one older adult is one older adult, what we call heterogeneous. Obesity is a heterogeneous disease. One person with obesity is one person with obesity is one person with obesity. You have two diseases or two syndromes or two paradigms of complexity, which makes things even more complex. So it creates a lot of challenges, but I think we're all up for this challenge. And I'm really excited to be part of this, the science, and be able to advocate how we can best care for our patients at the end of the day.
Thanks so much for joining me. As always, it's always a pleasure to sit down with you. And thanks for joining me here in our podcast booth at GSA 2024. And to those listening, I hope you found this episode of the GSA Momentum Discussion podcast informative and enjoyable. Thanks again, Dr. Batsis.
You're very welcome. Thank you.
Check out GSA Enrich at gsaenrich.geron.org, which is your gateway to a library of engaging learning resources. Access toolkits, courses, webinars, and more podcasts, all tailored to support your interest and advancement in the field of aging.